Which of the following is most appropriate next step in the management of this patient? 45-year-old woman presents to the ED with a 6-hour history of severe crampy right upper quadrant abdominal pain. Pain radiates to her right shoulder, associated with nausea and vomiting. Has a history of similar episodes in the past, but this episode is more severe. Her vital signs are stable, and her labs show normal white blood cell count, liver function. Abdominal ultrasound reveals cholelithiasis, thickened gallbladder wall without pericholecystic fluid or common bile duct dilation, which is the most appropriate step. Okay. Um, these always confuse me here. Okay, so she definitely has that right upper quadrant, radiating to the right shoulder. Um, so it's definitely that. Hmm, I think ERCP is only after you do a cholecystectomy. Um, let's see. Does she have? I'm wondering if you need it right now or she's had similar history episodes like this. I'm just wondering if it's immediate or a cholecystectomy or you can kind of wait. Her vital signs are stable. She has normal white cell count. She just has like those stones in there without. I mean, the common bile duct does not dilate, so it's not stuck. So I might schedule the elective cholecystectomy. Um, yeah, not exact.
Final answer.
Yeah, not super confident, but yeah, I think I would go a little more conservative. Okay,
So I'll talk to you why you want to do it faster rather than later. So this goes back to, does she have acute cholecystitis right now?
yes.
Right. That's the question you should be asking. Does she have acute cholecystitis, meaning acute gallbladder infection? And remember, she's in the emergency room, right?
Okay.
So she has inflammation, right? Thickened gallbladder. She doesn't have fluid around it or around the common bile duct, but it is thickened. It looks inflamed. There are gallstones. She does have normal white blood cell count, right? But she's having that pain. She has, Murphy sign positive, right?
Mm-hmm.
She has this crampiness, right? And she's laying in the ER. So, her gallbladder is inflamed. And so the question is, if not, then she's gonna just go home and be in pain for who knows how long, right?
Okay.
And it could eventually come even worse, and she might get septic, etc. So I think at this point, clinically, she's already in the ER. She has acute cholecystitis. You can say, okay, let me book her and take out her gallbladder. So this goes back to the thing. If she came to clinic and said, hey, I have these episodes where I do have pain in my gallbladder, that or right upper quadrant pain that radiates to the shoulder, you do see stones, but she's not actively in pain, then you can say, oh yeah, you fit, you have episodic, gallstone pain or colicky pain. So then you have criteria to take it out electively. But once
Okay.
they end up in the ER with, all these symptoms, then you're going to want to take it out now.
Okay.
Does that
That
make
makes
sense?
Yeah, that makes sense. I keep looking for like these, fever or something else, and what I'm learning here is they don't need to have like every sign. It could still be
Yeah.
it still could be immediate.
Yeah, exactly. Right. Remember, in clinic, right? Sure, are most of these patients going to have fever and things like that? Yeah, but on the test, they don't have to have everything. Just look at the
Okay.
clinical scenario overall, right? They're in the ER,
Okay. Okay. That makes more sense.